Shared motherhood is a lovely way in which two people in a same-sex relationship can both be part of the parenting journey. So in this scenario, one partner will provide the eggs. These are fertilized outside the body in one of our laboratory dishes in vitro to create an embryo, which is grown normally for about 5 days. And that embryo is then replaced in the other partner's womb to grow into the pregnancy, hopefully. And we're finding more and more same-sex couples looking at this option as they can enjoy that part of parenting together and both feel part of the journey. So what does it mean for the person providing the eggs? Well, that is really quite simple. It involves undergoing an ovarian stimulation cycle where they will take fertility hormone injections over a period of about 2 weeks to stimulate their ovaries to produce a good number of eggs. Now, the body naturally produces 1 egg each month, but when you do hormone injections, you can encourage more eggs to grow at once. These are the awake eggs that we all have in our ovaries during the cycle. Normally one is just ripe and ready to start growing and ovulate, but in a planned cycle we can synchronize the growth of a good number of eggs. It does depend, of course, on your age and egg reserve, and we can grow those eggs to collect them and then in the laboratory place the eggs with donor sperm. It probably involves coming to the clinic 3 or 4 times over 2 weeks to be monitored with ultrasound scan and blood tests and taking daily subcutaneous injections, which we show you how to do. Once you come in for your egg collection, you'll be looked after by a fantastic team. You'll see one of our consultant anaesthetists who will provide you with some sedation, which will make you sort of very relaxed and fall asleep during the actual egg collection procedure, which is carried out by one of our fertility expert consultants. During that time, you will have an internal scan, and there'll be a tiny little needle which will go into each ovary to collect the fluid from these little sacs that we can see on scan, and hopefully within each sac there is a healthy egg. And those eggs will then be passed to the laboratory. Meanwhile, if we're doing a synchronized cycle where your partner is being prepared within the same cycle as your egg collection cycle, your partner will be taking some hormones. They're basically HRT tablets to build up her womb lining in preparation for the embryo transfer, and will then also take some progesterone, normally in the form of pessaries, in preparation once you've had the egg collection, and then the embryo transfer is done 5 days after your egg collection. The way that we select the embryos is to transfer is by growing the fertilized eggs for about 5 days. This is a really important time during which some fertilized eggs will stop growing. That's normal. We really want to try and pick the very best embryo to put back. So we grow the embryos to what is called the blastocyst stage, when they're between 120 to 140 cells, and they have some cells which are specialized, which will form the baby, and some cells which will form the placenta. We pick the very top embryo we can to do the transfer, and it's a very simple procedure where the embryo is loaded into very fine tubing and passed into the uterus, and you can both be there. It's not something that requires anesthetic or anything. It's not painful, and any surplus top quality embryos can be frozen for future use. Not everybody gets any embryos that are surplus to freeze, but it's obviously, you know, a good opportunity if we do to not waste them, because you could subsequently have another attempt at treatment without having to go through all the injections. The good news is that the regulator of IVF in our country, the Human Fertilization and Embryology Authority, or HFEA, have recently changed the legislation around the screening requirements for shared motherhood, and so in a same-sex relationship you do not have to have any additional tests to allow you to donate eggs to your partner. You simply have to have the standard tests, which everybody has to have, heterosexual couples as well as same-sex couples, which is HIV, hepatitis B and C, and certainly in our clinic we also do chlamydia as a routine screening test, but it's that's just to make sure that we minimise any risks at all of infection. Both of you are therefore able to take part in the fertility journey, and obviously at the end you will both feel very much bonded to your child, in the sense that one of you will be the biological parent and one of you will be the birth parent.